Hey everybody, Chris Bailey here with Physical Therapy and Balance Centers, and what I'm going to go through today is to talk about low back stenosis or arthritis. I talked about the anatomy in detail in one of the first talks, just going through what the different problems are. So when somebody has stenosis, that just means that it's a hole that's closing down. And when we're talking about stenosis in the low back, and when we're talking about the lower back, it's the 5 lower bones and discs through the spine. What happens is these little holes where these nerves come out of the side of the vertebrae here get pinched. When they get pinched, that can cause pain shooting into the leg. It can cause pain when you're up and walking for a time that goes down into the butt, sometimes in the front of the hip, down into the leg. It can cause fatigue in the legs after you're standing or walking for a period of time, or after you're doing some movements up like this overhead where your back is arched. What we try and do most of the time with these folks are a couple of things. The first thing is we like to do stretches that start to bring the trunk forward like this. What that does is, this is the back of the spine here. This is a disc in between the two vertebrae. It opens up this canal and the nerves come out of this canal here. And usually with stenosis, that's what we're talking about, is those nerves get pinched. So movements that go forward would be a movement forward, trying to bend your toes down that direction there. It could be something as simple as sitting in a chair and bending forward. But the other thing that we would look at too, and what we want to work on, is trying to loosen up the muscles in the front of the hip, because what happens when they tighten is that it tends to pull the pelvis in this direction forward like that. And as it does that, it pinches down on those holes and can create worsening pain down into the legs. So some common treatments that we do besides trying to stretch these muscles out, trying to bend forwards to open up those holes, or do some other manual techniques that would be a little bit more pressure to try and open up that canal space. And then the other treatment that we do a lot of times is decompression therapy. And what that does, instead of opening up the spine bending forwards, is that we provide a force through a specific computer machine that stretches it this direction. And in that stretch, it also opens up those channels. And if we can keep those channels open for a little longer period of time than normal, it takes pressure off the nerve and can decrease inflammation and stress on the nerve. Another treatment that can work well that we do here is called deep tissue laser therapy, which puts laser beams down into the area of injured or compressed tissues to help with the healing process. So if you try these exercises or those movements in our Active at Home series for a few weeks and have some relief, excellent. If not, get a hold of us and there could be some other treatments we could help you with. So please try those out. We'll have the Active at Home posted on our website. If you have any questions, just give us a call. Thank you.